Yeah. Good afternoon. Whoops. It's a little louder than I expected. I just wanted to. Joined today by Council members Jacob Fry, Lisa Bender, Andrew Johnson, and Alondra Cano. We have 5 items on our agenda, and we're going to begin with our first item, which is a public hearing to consider the Charter Department head reappointment of Gretchen Musicant to the position of Commissioner of Health and Director of the Health Department. And this would be for a 2-year term beginning January 2nd, 2014. I know that we want some, I'll give Gretchen an opportunity, or Ms. Musicant an opportunity to address us as well, and maybe to start this off. So if you could just come up, give us just a couple minutes maybe, and reintroduce yourself to us, and give us a little picture of what you want to accomplish in the next term.
Okay, thank you, Mr. Chair. Gretchen Musicant, serving as Commissioner of Health, even though I haven't been formally reappointed, as I have been since 2005. And so I wanted to take this opportunity at your invitation just to talk a little bit about what's happened or what we've been able to accomplish in that time. And everything I talk about today is built on really talented, energetic, dedicated staff that we have in the department. So it's not about me. In fact, I don't like this about me. I really like topics and issues and moving agendas forward. But I will talk a little bit about what the department has accomplished. Oftentimes when we think about investing in prevention, it seems like the payoff is going to be far in the future. We don't know what the results are. We're going to be able to measure it. And yet, perhaps because I've been here since 2005, we have moved the dial significantly on a number of topics. Teen pregnancy has declined by half. Youth homicides, in 2013, there were no homicides for people under 18. That's the first time that has happened in my tenure here. When it comes to youth violence, it's dropped by 60%. Incidents with guns amongst youth have decreased by 67%. Lead poisoning, we've had more than an 80% reduction. We've nearly doubled 3-year-olds getting preschool screening. So those are just a sample, but usually I think in terms of 3% here or 10%, not 60% or doubled or halved. And so I think that's really exciting to think about how different this city is in some ways than it was a decade ago. We're investing in things like healthy living. Over the past 4 years, we've touched about almost 500 different sites across the city to make healthy choices an easier choice. We provide a lot of safety net services, both in clinics and clinics we operate ourselves, community clinics, dental care, home visiting. In the last year, I've overseen the reincorporation of environmental health back into the department. That was part of the department 20 years ago, before I was here, and it's been a very exciting, I think, and successful year. And even in that year, as we've been incorporating them in the department, they've done fabulous new exciting things, in addition to figuring out their new location. So we've got healthy homes repairs going on in family daycare settings that wasn't happening before. We've got public reporting of building energy use going on. We're helping businesses convert operations to greener alternatives. We've also had an eye towards research, trying to take community wisdom and make it into something that is a best practice. Oftentimes, best practices in the literature and community wisdom are two different worlds, and they kind of compete. We have to do a best practice, but the community thinks something else is a better idea. We've tried to bring them together. We worked with a couple of community-based organizations to create something called Scene on the Streets, which was a federally funded program, research program, to look at how can we reach young men who are not connected to healthcare and work with them on sexually transmitted diseases. It received an award for innovation from the U.S. Department of Health and Human Services. In the same way, we know that social conditions really impact whether or not people can be healthy. And so as part of our Healthy Start program, we created a web-based interview system that looked at identifying needs in transportation, housing, food insecurity, social support, mental health. And that work has been featured on the Health and Human Services Resources Administration website and has been a part of 9 published journal articles in scientific journals. So we're bringing this community wisdom into a new respectability. Over the past just handful of years, we've actually received a number of honors. We've been chosen as one of the first 6 cities chosen by the Robert Wood Johnson Foundation for their Roadmaps to Health Prize. And we were also chosen in a competitive process as one of 4 cities to join the National Forum on Youth Violence Prevention. So going forward, which I think is what you asked me to talk about, despite these real measurable progress that I've talked about, many health disparities remain. There's plenty of work left to do. Because of the mayor's articulated particular interest in early childhood, we've brought together some disparate investments that we had in early childhood and are creating a maternal child health strategic plan, and we'll be rolling that out. We are going to be seeking National Public Health Agency accreditation this year. We are also finalizing our work to have Healthy Homes accreditation with the HUD federal agency, and we are implementing our newly revised blueprint to end youth violence. We will continue to make policy, system, and environmental changes throughout the city so that healthy choices are easier choices, and we'll continue to be very innovative and solid in our environmental health work. So that is my opening summation, and if there are questions now or later, I'd be happy to take them.
Well, thank you very much. I don't see any questions right now. Oh, okay. But except perhaps a comment or question from the mayor. Welcome.
Thank you, Mr. Chair. I would love to, I'm very proud to have forwarded the name of Gretchen Musicant for reappointment as Director of the Health Department. Gretchen and I lived in the same neighborhood for 15 years, or Ms. Musicant and I lived in the same neighborhood for 15 years. But I did not, but she and I started at she started at the city about a year before I did, and I did not fully realize how broad and deep her capacity was to do this work until I had been here and I had been working with her here some time as a council member. I would say first, just on a purely practical level, she not only did a great job holding it together in the years where the health department did well to just keep its head down and do its work, but that she got the results that she's been enumerating here. And many of those, there's a full team of people in the health department doing that work, and they are led by Gretchen Musicant, who has gotten incredible results. For the city of Minneapolis, but for the residents of Minneapolis that have made a big and practical difference in people's lived lives and how well people are doing and how much our community is able to thrive. That preventive work is crucial, as we know. The practicality of that, the ability of, every time I've heard about it, every year during the budget process, every year during presentations, getting the raw numbers on how much public dollars goes into our health department, how many city dollars goes into our health department versus the millions, the tens of millions of dollars that our health department has leveraged with those dollars, and how all of them are put to use really well on behalf of the people of Minneapolis is extraordinary. I don't think there's another department that can make that same claim to that same level. Just the persistent and good use of partnerships at every level to help bring more money to this effort is extraordinary. And it matters. And it matters in part because our health department is doing some of the best and most effective equity work of any department in the city. That these health disparities, that these health outcomes are not across the board equal, that these health outcomes are very much differential and negative in communities of color and in low-income communities, and that is where this work has been focused, and that is where this work has had the most success. And as Ms. Musicant said, we have done groundbreaking work region-wide, statewide, and nationwide, and people look to us to be leaders on a whole host of the issues that Ms. Musicant and more has laid out here today. And so I just think her leadership has been fantastic. As we all together head into the next era of our city and the next era of the work we want to do on equity, on these health disparities, I am very excited to see what Ms. Musicant is going to help us do and what she brings to the table to help us reach our highest and biggest goals in terms of equity. And I'm very excited about it and very excited about working with her moving forward, and ask that you support her appointment.
Well, thank you very much. I think what I'll do next is open the public hearing. I know there's some people here who want to speak. There's a couple people who signed in, so I think we'll start with them. And if there's other comments or questions from the committee members, we can deal with those after the public hearing. So the first name I have is Julie Ring. And if you can come up and you can state your name and address for the record. That's what we usually do here. And then try to keep your comments to 2 or 3 minutes. It would be appreciated.
Thank you, Chair Gordon and members of the committee. My name is Julie Ring. I live at 3435 McKinley Street Northeast in Minneapolis, and I'm here today as a private citizen to speak in support of Gretchen Musicant's reappointment in her service to our city as Commissioner of Health. I currently serve as a citizen volunteer on the city's Public Health Advisory Committee, but I've known Gretchen for much of my career, and more than a decade, I would say, from my time working as the local government liaison at our state health department, and also my time as the executive director of Minnesota's local public health association. During that time, I saw Gretchen serve as a leader among leaders, a leader among those health directors from across the whole state of Minnesota. She's known for asking important questions of her peers, of her staff, of her volunteer committee members. She asks others to examine how they devote their time and public resources to improving the health of our public. Recognizing her statewide leadership, her peers from across the state elected her as the chair of the Minnesota Local Public Health Association just last year. Gretchen has been recognized with state and national awards, but I know that's not what drives her, and you can hear that somewhat in the way she speaks about her work at the department. Many of you know Gretchen, some of you maybe better than others, but you know that she's deeply committed to public health, to health equity, and to social justice. In just the past year, the City Council entrusted her with expanded responsibilities by moving the environmental health and food safety work back underneath the Public Health Department. For those of you who don't know Gretchen as well yet, I'm confident that you'll be impressed with her commitment to the health of our city. I'm proud to work with Gretchen, I'm proud to live in the city of Minneapolis, and I'm proud to support her here today. Thank you.
Thank you very much. The next person who signed in is Akamiri, and I'm going to let you pronounce your last name, and hopefully I got the first name close. Welcome.
Yes, you did. Good afternoon, Council Chair, Council members. My name is Akamiri Sakara, and I am an employee at the Cultural Wellness Center. We are pleased to have this opportunity to share with you how effective it has been having Commissioner Gretchen Musicant as our active participant in our Backyard Initiative. The Backyard Initiative is a partnership facilitated by the Cultural Wellness Center between Elina and the communities that surround their headquarters, which is connected to the Midtown Global Market. Gretchen has been selected by the community members to sit on both the BYI Community Resource Board and the BYI Community Commission on Health. Her voice has been very powerful in lending knowledge from the City of Minneapolis public health platform. She is a coach, a counselor, and a tireless participant in the community's work to improve its own health. We strongly encourage her reappointment as the Commissioner of Health for the City of Minneapolis. Sincerely, the Cultural Wellness Center, Elina staff, and the BYI community members. Thank you.
Thank you very much. There's nobody else signed in, so now it's open to whoever wants to come up next and speak. If there are more people, you can just come up and give your name and address for the record. Welcome.
Thank you. Judith Kahn. I am a Minneapolis resident at 575 North First Street in Minneapolis, and I'm also the executive director of TeenWise Minnesota, and I'm here to speak in support of Gretchen Musicant's appointment. I've known Gretchen for at least a dozen years when I ran an adolescent health institute at the University of Minnesota, when I was director of the Minneapolis Youth Coordinating Board, and then now in my role as director of TeenWise Minnesota. Our work kind of focuses around our shared interest in the well-being of children and youth. And in that context, Gretchen understands and embraces the unique and influential roles that local decision makers can play in strengthening families and improving outcomes for children and youth. Gretchen, as you've already heard, was very much involved in the youth violence prevention, the blueprint for action. What she didn't say was that she was really the champion for bringing forward the recommendation to the city council and to the mayor's office to approach the city's youth violence challenges by treating it like the public health problem that it is. It's a strategy endorsed by national and international public health agencies, much less frequently by municipal governments. Defining violence as a public health program opened the doors to a range of strategies that tend to be more effective than singular and heavily law enforcement approaches, and it really helped this city mobilize around with and around its youth. I was directing the Youth Coordinating Board when the Blueprint for Action was being developed, so Gretchen and I worked very closely together. Prior to that, the YCB and the Health Department had been working together on other issues related to children and youth, and we cost-shared a youth development specialist position, a unique situation where neither one of us had the money for a full-time position, so we pooled our resources and made it happen, which is very typical of how Gretchen approaches it. Most recently, as the director of TeenWise Minnesota, which is formally known as, I have to take a breath to say this name, the Minnesota Organization on Adolescent Pregnancy Prevention and Parenting. Now you know why we changed our name. So we have the city health department and now TeenWise Minnesota. We've worked together since 2009 on a variety of initiatives, including the formation of the Teen Parent Connection, advocacy to retain policies that support adolescent health, such as the minors' consent legislation, and the Minneapolis Urban Initiative, which focuses on bringing sexuality into education into the Minneapolis public schools, a very successful effort, in fact. So if I had to sum it up, I would say that Gretchen is very data-driven. She is prevention and health promotion oriented. She believes in strategies being science-based, but respects that implementation may be far more nuanced. She understands that collaborating across disciplines is messy, but often the only way to go to get the work done. And she operates from a perspective that asks, does this strategy, does this project, does this initiative support or hinder the well-being of children, youth, and families? And that's really what drives her work on a daily basis. So I would encourage this committee to reappoint Gretchen Musicant as Commissioner of the Minneapolis Health Department. Thank you.
Thank you very much. Welcome.
Welcome. I'm Allison Rotel. I live at 5517 Pillsbury Avenue South, and I'm here wearing two hats. First, I work in the Center for Prevention at Blue Cross and Blue Shield of Minnesota. For those of you who know, we're the department within Blue Cross that administers the tobacco settlement dollars, working on improving health for all of Minnesota. Minneapolis, as the state's largest city, is obviously very, very influential and has been a really key partner in many of the initiatives that we work on, and has been a really valuable contributor to changing health outcomes for the state by influencing their residents. And I just wanted to give a few quick examples. We work in 3 areas, so working on healthy eating, tobacco control, and active living. And I wanted to point out that the city, under Ms. Musicant's leadership, has been very, very instrumental in implementing EBT access at our farmers markets, so ensuring that people who use public benefits for food assistance are able to utilize those benefits to access healthy, fresh, and affordable foods that are in season here at our local markets, and really helping to address the equity issue that's inherent in the way the EBT system has failed some of our most vulnerable residents previously, and really seeing an increase in usage of EBT at farmers markets, first in Minneapolis, and then that work has inspired over 50 markets across the state to adopt a similar model. And Minneapolis was very, very much in a leadership position to help make that happen. Another example would be the work, so Blue Cross as a funder, it's interesting the partnership we've been able to have with the city. In the case of the EBT work, we were collaborators because they had funding from a different source and we were funding some of the other elements of the project. So we really worked as equal partners. In the active living example I'd like to highlight, we are funding the city, and through the Active Living for All initiative, the city is going to be working on community engagement and a preliminary plan to create a greenway in North Minneapolis, which we know those biking assets are really critical to working on health equity issues on the north side. And then the third issue is we work on is tobacco control. And I understand that just recently, under Ms. Musicant's leadership, the city has adopted the e-cigarette changes into their policy platform in terms of adding e-cigarettes to our statewide smoke-free law. And I think while there's certainly a lot of work to be done in all three of these critical areas, there has been a lot of success in Minneapolis, and I just want to emphasize that Minneapolis is looked to by health departments all across the state and nationally, has been recognized by Robert Wood Johnson, presents frequently at national conferences, and is really held up as a gem of a health department. I mean, you're very, very lucky to have Ms. Musicant as the commissioner, as well as the excellent staff that she oversees in doing this important work. The other hat that I wear is as I'm just beginning my second term on the Homegrown Minneapolis Food Council, and I would say that the health department was instrumental in launching the Homegrown Minneapolis effort and in the creation of the Food Council, along with your leadership, Chair Gordon. And support from the overall city council, and that initiative has seen many successes, certainly lots of emphasis in the last couple of years on expanding urban agriculture and growing food in the city, but I think you'll see in the future other aspects related to really ensuring an equitable and healthy food supply for all Minneapolis residents. So with those things in mind, I would encourage you to reappoint Gretchen Musicant as the Commissioner of Health. Thank you.
Thank you very much. Is there anybody else who would like to speak? Welcome. Glad you're here.
Good to be here. I'm Titi Layo Bidiaco. I live at 3424 Portland, and so I'm a resident of Minneapolis, and I'm also the executive director of We Win Institute, which is on 37th and 17th Avenue, and our mission is the academic and social success of all children, and I am a board member of the Blueprint for Youth Violence Prevention, and I am here in terms of everyone else, in terms of supporting the reappointment of Gretchen, and I can just say a couple of things in terms of the Blueprint. The one thing that she made sure that happened in terms of the board is that it's certainly in line with the direction of the mayor in terms of One Minneapolis, because we are certainly a diverse board. And we lost our coordinator, and I was part of the committee in terms of getting a new person. And so we put out all of the things in terms of getting a new coordinator and did endless amounts of interviews, and it was really interesting being a person that was part of it. After we did all these interviews, the person that Gretchen and the health department was looking for didn't happen in the first interview, and something very surprising happened. They put out the call again for more interviews, and Gretchen made sure that she was part of that. And I think as a result, we have a person that really represents the Blueprint very, very well. And I'm also, my organization is part of the Urban Garden movement and part of Northside Fresh. And I think that one thing that we can see that's happening in Minneapolis and is very important is urban gardening or urban farming, of which the health department has been strong supporters of. And so with everyone else that's spoken, I'm in strong support for the reappointment of Gretchen. Thank you.
Thank you very much. Well, welcome back, Councilmember Zerbe.
Mr. Chair, Mayor, council members, I'm encouraged, frankly, maybe a little out of line, but it's encouraging to see so many good, fresh faces engaged on this committee. And this is a committee I hope you will find and make very rewarding. I think the single thing that I was a part of that I'm most proud of my years down here was when we took some strong steps to cut down on secondhand smoking. And I can look out and think that's saving some lives every year. And that's very worthwhile. Anyway, I'm here and appreciate the invitation from the chair to speak in support of the reappointment of Gretchen Musicant as Commissioner of Health. I haven't known Gretchen as long as the mayor, but I knew her husband a long time before I knew Gretchen, the late husband, Ivan Musicant, who was one heck of a writer and historian. And he and I were in a writing group together, used to meet upstairs at the Mixed Blood on Saturday mornings. So I don't know if you knew that. But anyway, I think she has impressed me from the time I first met her when I was still on the predecessor to this committee, through the time when I worked on the Public Health Advisory Committee, which has been mentioned here. And she has, from the outset, shown a keen sense of what are the uniquely urban public health problems that can be addressed most effectively at the city level. And that's right from the get-go. I mean, working on lead, violence, disparities, ethnic, racial, economic disparities, right from the beginning. And I know she's continued to work on those, as you've heard here, prevention on youth violence and healthy residents. And she has been a very innovative commissioner, I think, willing to reach out. I forget whether it was through the Public Health Committee or PHAC, but in any event, I recall the department put together a very telling video, which was arrived at by going to different communities and with translators and asking those communities to tell their stories. Tell us when they were more healthy. Why were they more healthy? What would make them more healthy? I think that was put together by Gretchen with maybe Tony Looking Elk and Emily Wonk from the department. And the department was properly honored for that. The university was very impressed with what the department had done. Just recently, I was at a meeting last week, Thursday night, where we had a presentation from a fellow named John Fassman, who was the Atlanta correspondent for The Economist magazine, heck of a good magazine if you read it. And he had written a piece, and he has promised to clean it up a little and send it to me, and I'll pass it on, but on an investigation he did in Atlanta on the high cost of being poor, why it's so expensive to be poor. And he contrasted the produce, the meat, the things that were available at a suburban Costco and the prices compared with the much less plentiful set of choices and much higher prices at inner city stores. Well, of course, that is something the department has been addressing through its Healthy Stores, Healthy Corner Stores initiative. And I was pleased when this fellow finished. He twice gave a shout out to the Minneapolis Health Department and its Healthy Corner Stores initiative as an effective way to be addressing those problems. And like the mayor, I mean, I'm pleased, I think we're all pleased when there is outside recognition of the efforts that take place here. But beyond that and underneath that is the hard work, the results that result in that recognition. So I think we are very fortunate to have Gretchen Musicant as our health commissioner, and I would urge you to approve her reappointment as health commissioner. Thank you.
Thank you very much. Is there anyone else here who came to speak today? Seeing no one, I will close the public hearing, and I will see if my colleagues have any comments or questions. Councilmember Johnson.
Thank you, Mr. Chair. I just wanted to say your work has been so impressive and meaningful. And I think someone said it best, you have saved lives. This department has saved lives, and only a few departments within our city can really say that. And it's just wonderful. I know you have a wonderful team as well, and which you acknowledged. And I'd just like to thank our mayor as well for this reappointment. So, and everyone else who came out today to speak on your behalf. So thank you for your work, and I would encourage you to just keep doing the good work. There are a lot of challenges ahead in general within the city, and I have confidence that you and your team will rise to those challenges. Thanks.
Thank you. Councilmember Frye.
Thank you, Chair Gordon. Just briefly, I also want to comment on the extraordinary work of Gretchen Musicant, specifically in the area of sex education and teen pregnancy. This is an issue that's very important to me personally, and it's also an issue that you've seen just resounding results, which I was not aware of until I joined the council. So thank you for your work. I'm very supportive, and I look forward to working with you more.
Thank you very much. And I also want to add my support for this reappointment. It's been a pleasure the last 8 years having the opportunity to work with Ms. Musicant as Commissioner of Health. I think that some of the ideas that you've brought forward have really resonated with what I've wanted to accomplish and do. So you've kind of helped me develop my own work plan here on the council. And occasionally, I'm sure I was getting some credit that really should have gone to you in terms of some of the initiatives that I was working on. I also am really impressed by the health department in general under your leadership and its ability to work with community and also its ability to work with other departments and with others. I think that the department is really a model in the city, I think, of how we could create an environment where the staff feel empowered and excited about really making a difference, and then also the support for reaching across and outside what you call them silos here a lot. I hadn't heard that before I got elected, but that's apparently it's an agricultural term, but it applies in city government. But working across the silos and working with other departments to really get things done. I think part of that is because it was not a necessity. The health department, for years, we called it the little department that could here because it was so small. And in order to get the funding, it had to reach outside, and in order to accomplish big goals, it had to work with others well. Now, I'm excited that the department has expanded now, and it has more staff there and more work that it has to do, and I look forward to that. But I just think it's a department we can really look to as a model for maybe how other departments could work really well also, and I appreciate that, and I think it's due in large part to your leadership. It's always hard to know that the climate or the atmosphere in departments too, so if I'm wrong about the staff being empowered and feeling excited about work, I can stand corrected. But that's the impression I get here, and I think that it's really powerful, and I hope that's the way that it is. I think that there's a couple more comments. Maybe Councilmember Bender.
Thank you, Mr. Chair. I just wanted to, I worked at the Minnesota Department of Health briefly before taking office. And so I knew then that our health department in Minneapolis was a leader nationally. And I just wanted to reemphasize that. And I think that Ms. Musicant's leadership is a lot of the reason for that. And I just think that this is a good reminder for all of us as policymakers of the opportunity that we have with such an excellent department to be really forward-looking in our policies about health. And we have a mayor who's prioritizing early childhood development. We have a new configured committee that really, I think, elevates the leadership that Councilmember Gordon has given on these issues. And so I just wanted to kind of note that this is such a great reminder of the work that we can continue to do to address the health disparities in our city, to really tackle a lot of these challenges in a really innovative and forward-looking way. So thank you. I'm excited to support this reappointment.
Well, thank you very much. I think with that, then, I will move this forward. All those in favor, say aye. Aye. Opposed? All right, that reappointment is approved, and it will go to the full council. Thank you very much for everybody that came down today to talk about that too. And I would point out that Councilmember Glidden wished that she could be here, but there was a big public hearing at the legislature on energy issues, which this committee also cares greatly about. And I couldn't go, and she was willing to go and represent us, and I know she's doing a good job there. But I think she would have been very supportive of the reappointment too. We also have some other items on our agenda that we'll move on to. People don't have to stay for these, but you're welcome to. Of course, you know that already. These are our consent items, and I'll just go through the list, and if any council member would like to pull anything off for discussion, we can do that. The first one of those is the second item on our agenda, which is to approve the appointments to our Public Health Advisory Committee. The appointments I know this has changed a little bit, but I think they're all current on the website right now. And I can read off the proposed appointees, and you can correct me if I've got this wrong, but it's Dr. Abdullahi from Ward 3, Seng Koo from Ward 4, Karen Soderberg, Ward 7, Dr. Rebecca Thoman from Ward 13, Linda Brandt, the Hennepin County Human Services and Public Health Representative, Julie Ring from Ward 1, who's joining us today, Bertie Cunningham, Ward 11, Autumn Chmielewski, probably mispronounced that, from Ward 12, Jennifer Pelletier, that's the U of M School of Public Health representative, Dan Brady, a member at large, Tara Jensen from Ward 5, and Dr. Happy Reynolds Cook from Ward 6, Abdullahi Sheikh from Ward 8, and Joseph Kaliani, a member at large. The second item on our consent agenda is to authorize execution of a 5-year affiliation agreement with the University of Minnesota through its family medicine residency program to provide medical rotation site through the school-based clinic program. Fourth item is to authorize an application for a 3-year grant from the Centers for Disease Control and Prevention for the amount not to exceed $750,000 beginning September 1, 2014. And the final item is to approve a resolution supporting the city's participation in Earth Hour on March 29th, 2014 from 8:30 to 9:30 p.m. Do any committee members have any questions or comments on any of those issues? And Councilmember Fry, I assume that your card is up from a previous item? Okay, that's just fine. Then I will call. Did you have a correction to make on that? Did I read the wrong list?
Yes.
Sorry, I thought that might happen. You might have seen me thinking that might happen. Correct my mistakes.
Councilmember Gordon and committee, Becky McIntosh in the Health Department, and I apologize. It was a little confusing. We've trying to figure out, working with the city clerk's office to get the correct list at this time. So you should have a copy of the revised letter that shows Sang Koo, Karen Soderberg, Dr. Rebecca Thoman, Linda Brandt as being reappointed, and then some corrections for Tara Jensen, Dr. Reynolds Cook, Abdullah Sheikh, and Joseph Koliani. That's the corrected list.
Okay, so that's the list that I will be moving. I then obviously added a couple extra people who aren't on this round but might be coming up in future rounds in April.
Towards the end of April, the 2014 appointments. That will get us all on the correct page between the department, the committee, and the city clerk's office.
I apologize. I read the wrong piece of paper.
Thank you. Well, you've had several of them too.
Okay. Hopefully that's clear for everybody. Okay, all of those in favor of the consent items then with the corrections made on the Public Health Advisory Committee, say aye. Any opposed? Any abstentions? Those motions carry. I think we have one brief announcement then before I adjourn. Councilmember Kano, would you like to announce?
Sure. Thank you, Mr. Chair. So we just wanted to invite the community and remind the community about the Zero Waste Forum that we are, many of us council members are hosting together with the mayor's office as well as U.S. Congressman Keith Ellison, along with State Representative Frank Hornstein. So it's happening this Thursday from 6 to 8 p.m. at the Walker Community Church, which is located at 3104 16th Avenue South. So this is going to be a really, really exciting event. Many of us are looking forward to having a comprehensive conversation about what this looks like for the city. I know that Councilmember Gordon has been a strong leader of sustainability initiatives, and many of us who are new council members here, which I think is all of us sitting at this table, are more than energized to help these efforts become a reality as a citywide effort. So we're hoping everyone can come. We will have childcare available, interpreting on site, food, and we're also hoping to have folks from San Francisco join us via Skype. We're still trying to make sure that that's going to happen. So these folks have been doing zero waste initiatives in San Francisco very successfully, and we're hoping to learn from their efforts. And then we're inviting community organizations or groups that are working on zero waste initiatives or initiatives to help reduce waste in our city to come and table at the event from about 8 to 9 so we can have an informal networking session and conversation.
All right, excellent. Thank you very much. And with that, seeing no further business before us, this meeting is adjourned.